Dr. Berry, licensed psychologist, and here I share legal and entertainment news from a psychological perspective. The case of Wade Wilson, so I did follow it when it was happening, earlier in the year. I followed the trial, I followed everything that was happening, and I didn't cover it back then. And I wasn't even, when I covered it a few days ago, I didn't even know that they had this hearing coming up. And a lot of really interesting things happened during this hearing between a neurologist and then a pathologist and the comparison between the two experts is night and day. One expert comes across like he's trying to make it fit the scenario when it might not fit what he's trying to say. And I think the second expert for the state did a really good job just talking about the pathology of the brain and how this what the first expert said, any holes in that person's testimony. And we are going to watch it during all of this conversation about this, the concept of y'all know me and words, hybristophilia, that ended up coming up. And I did do some research. It's not something that I learned about in school. I know that we talked about like the Bonnie and Clyde syndrome. We talked about people being attracted to people that commit crimes. We definitely talked about that. This is a specific term, and it's often researched by sex therapists. And because it's within the philias, it's within that genre. And we're going to talk about the reasons why some individuals might be messaging him, sending him money, standing up for him in the chat. Oh my gosh, I was in Law and Crimes chat earlier today and it was flooded with just people saying save Wade and all of these other things. Um I just want to highlight that hybristophilia, there is a passive type and an aggressive type. And the passive one is just somebody that maybe thinks they can save this person. They, I don't, for some reason, they're attracted to, and my face is, I'm going to make weird faces as I talk about this because he repulses me. I subjected myself to probably hours of his phone calls and I just so I could try to understand. I wanna have some empathy for the individuals that truly are in love with him when really, in my opinion, he's only in love with himself. Like, that is it. He is purely in love with himself, and I am not gonna play any of his messages. So we're just gonna talk about it. If y'all would like to subject yourselves to that, because to me, from the very start of his phone calls, his messages should be played to teach individuals about manipulation, gaslighting, love bombing, because he starts every call with how much he loves the person and then immediately asks for something, talks about how much he needs them. And if at any point he feels that they're not on his side, he gets very aggressive and turns on them. And because I think it was Mila at one point, she's like, I can't believe you actually did this. And he just nonchalantly is like, I told you I was a killer. Like he just nonchalantly says that. And so his phone calls, he comes off as a complete antisocial psychopath to me, and he really is that perfect example of the dark triad in my opinion. This isn't a psychological evaluation. I can't assess him. He has been given the diagnosis of antisocial personality disorder, and so that's why I feel very comfortable talking about that. And so I did listen to Jumpsuit Pablo. I listened to the directly from the phone call. Like there's like jail phone calls was one channel, and then I also watched Wade's dad's interview. and I would like to clarify some things because I did a previous video and we weren't sure because we knew that Wade's mom was 14 when she had him and his dad was 15, and he admits his history with legal problems, but it sounds like he's got himself together. And Wade has distanced himself from his birth family because they set limits and boundaries with him. The only people reaching out to him are people that do not know him well, are people that have kind of fallen for the game that he plays in my personal opinion. And so I did also want to talk about the fact that his birth mother, she did not use substances according to the father, so I don't know. According to the father, and there's no record that he was born substance addicted. And they test for that at birth, and there's no indication that he was born addicted to any substances or on any substances or that she used substances at any point. His adoptive family sounds like they did the absolute best they could. They attempted to get him mental health treatment, and he had to do the work. And from everything I've seen, he made poor choices. He chose to do the things he chose to do. He seems to like to prey on vulnerable people. Like that's the only language I have for it because he picks people that he can dominate and he does not pick people that are on his physical level that could create any type of challenge. He comes across incredibly weak to me in my personal opinion. He comes across incredibly weak. He comes across very very problematic and I ugh, okay. So when it comes to hybristophilia, I listen to Dr. Grande's video. He did a video talking about women that fall in love with serial killers. It's from years ago, and I do have his full video linked down in the description. I researched. I looked at a lot of different people's videos, and his video was the best on this particular topic that I was able to find. And there is an aspect of this where people might get that attraction because he's in prison and he can't harm them. So his only options right today are the death penalty or life in prison without the possibility of parole. Those are his only two options. Before he was convicted, because he was talking with some of his former people that knew him before he went to jail, with some of those women, he was saying, "Once I get out of here, I can't wait to be with you." But even his behavior before he went to prison showed this pattern of manipulation, dominance. He was physically aggressive towards people that like, towards it's the allegations are towards women. I think there's evidence as well. And then, there's also some allegations of him being physically aggressive towards a former boyfriend as well. So, Lisa, I am not the type of person that would fall in love with somebody like him. So if he had never done the crimes, if he didn't have all of the tattoos and all those things, so could he be an attractive person? Sure, but his need for dominance, sadism, and his preying on vulnerable and manipulative people, that gives me a major ick. Like that just makes ugh, like that no thanks. That makes him not attractive to me, but there are people that number 1, they might not believe that he did the thing, and so I did wanna talk about the aggressive form of the hybristophilia as well, and that's the individual that would, like, try to help the person escape or bring them substances or that might want to do crimes with them. That's that type of individual, okay? I'm just monitoring the comments because I truly see him as an individual that used manipulation, dominance, but he preyed on vulnerable people. So he didn't pick situations that would be an actual fight. He only picked situations that were not fair and that he knew that he could dominate. And so yes, he definitely targets women more than men. It's my understanding that he has been aggressive towards at least one man that was a lover in the past, but it was somebody that was, I think, smaller in frame. He was described as kinda, like, cutesy, and so it sounds like it was somebody that he could dominate. Wade's father says that he does not do well with men, and he likely talks a big game and then can't back it up with somebody that can actually fight. I don't think he actually wanted a fight, and hearing him talk about just the pain that he had inflicted on his victims that survived, and just the emotional work that they have had to do, that they will have to continue to do. And so that's why I'm not going to replay those things here. Those messages are likely a snapshot of some of their most difficult moments, and I hope that people learn from it, because I think one of them, I don't remember which one, but I know somebody did an interview, 'cause I watched it, about the fact that they want their story to be able to help other victims that are in abusive, toxic relationships, and that they never really loved him, that it was really more of a, like, because I don't think he can love somebody else. He only loves from his perspective. His love only benefits him. I don't think it benefits the women at all. I don't know this for sure, but I could imagine an individual like him would probably be a selfish lover that, like, was only concerned about their wants and needs and not at all concerned about anybody else. That's just my hypothesis. I don't know that for sure. All right. So here is an article about why women are attracted to people like this. And the research, there is that term hybristophilia. And that is where people, and it's not just women. So it's also men that can be attracted to this, and a woman. So those are the men that probably write Jodi Arias. Like, I'm pretty sure Jodi Arias probably has some men that have, claimed to be in love with her, or different things like that. And so it's not only women, but it is an individual that is attracted to a dangerous person. And, like I mentioned, there is an aggressive type, and that's the individual that's more the Bonnie and Clyde. They wanna do crimes with them. And then the passive one, where they see that weak, small, broken child, and they want to heal them. And please know, the only person you can change is a child in diapers, or an adult in diapers, or a person that wears diapers. Like, you cannot change other people. I'm a licensed psychologist and I can't change people. I can encourage, I can support, but I don't change. My clients do the changing. They have to do the work. I can't do it for them. And so Wade has to decide to change, and I don't think he has any motivation to. What he's done has sadly, like, worked for him, and the reinforcement that he gets from these women, in my opinion, it causes him to be more fixed in who he is and how he operates. In my opinion, he comes across as an extremely insecure little boy, extremely insecure. You hear some of those calls, and he is, like, his need for attention. We're going to play part of the hearing from earlier, and he's going to, like, be talking to the female sitting next to him. He has this need for feminine attention and energy, but and so I don't know what they were talking about. Like, it seemed like the lady, she seemed nice. She's probably a paralegal or something. I would have asked to move. I would have asked to be separated from him. He was adopted, I think, at around 6 months old or so. He was adopted very young. His birth mother was unable to care for him, and it sounds like when he became an adult, he did get, like, him and his birth mother, I think did substances together or something. It sounds like his birth father is the one that is currently stable. I know nothing of his like birth mother's current situation, but it sounds like in the past that like she had some major struggles, and they might have related to one another more on a peer level than like a mother and son. And she was 14 years old when she had him, so if he's 30, then she's probably 44. So she's only 2 years older than I am. If he's 30. All right. And so, welcome to everybody in the chat. If you don't mind giving the video a quick like, and yes, yes. All right. All right. So there are some things that can go into why people are attracted to individuals like this. Sometimes it is a person that has their own history of trauma. It sometimes is a person that maybe doesn't have healthy, safe relationships, or that may view that chaos, that instability that might bring up like positive feelings for them. They might be drawn to that in another person. Uh and I think there are some people that support him and that think that he can change or think that he was framed or set up. And that's where I would want them to listen to those phone calls and to hear him talk about listen to him talk about what he did, and just the lack of any remorse, or like he shows no remorse for the victims at all. I meant to share my screen and I went to stop share. All right. Please, no spoilers in the chat as we're watching, because they might start the new hearing before I get started with this. We are going to start with the first expert right now. Let me know if y'all have questions about anything that I've covered or that I've said so far. The first expert, I personally feel Dr. Lewis was the worst, but like this was not great expert testimony to me. He did not review things that, if you're going up there saying this individual has a traumatic brain injury and you're basing that opinion based on some very basic test, and just from what I heard, because he had a thorough neuropsychological evaluation that took over 6 hours to complete. And then for this individual to do a few screening tests and then to say he has executive dysfunction, when the neuropsychologist tested his memory, and his memory was average. And the only times that his memory was lower was when he was probably tired. 6 hours of testing is a long time. I try to do my testing within 3 hours or less if I can. I try to keep it shorter, but neuropsychological evaluations are long. They just are. And that's where we get into malingering. Malingering, faking bad, or feigning symptoms, because an individual like Wade has a lot of motivation for a particular outcome to say like, "Oh yeah, you know, I don't, they're trying to have a certain result so that they don't get the death penalty." Like he has some motivation to not be forthright on these tests. So let's get started. There are going to be times where the sound on this isn't going to be great. I'll be honest. All right, let me see. Fast forward. And we're just gonna speed him up to 1.25, see how that goes. We'll see how that goes.
Name is Mark Patrick Rubino.
Mr. Rubino, how are you employed?
I'm self-employed
Right.
as a neurologist.
Are you an MD?
I am.
Can you give us a brief background of your educational history?
Yes, after graduating from high school, I entered into a 6-year
So he is certified as a neurologist.
practicing in Naples since 1999.
Right. You specialize in neurology, is that correct?
I do.
Are you board certified in neurology?
I am.
Have you ever testified as an expert in a case and allowed to give your opinion?
So he mostly testifies for defense, for the defense, and he is being paid at $400 an hour.
In person with him basically bound and shackled. And that's what my exam. And the second part was with him still bound and shackled behind a glass wall.
Okay.
But that was in person, I take it.
All right, the first time you visited with him, when he was bound and shackled, but you actually had contact with him, for what purpose was that contact?
That purpose of that was for my exam, my neurological examination.
Okay. What type of neurological examination?
Just a neurological examination.
Okay. Do you run several tests?
Yes, it has several parts to it.
All right. Why don't we go through the parts one at a time? What's the first part?
Mental status.
Okay. And how do you test that?
I usually do a Montreal cognitive assessment as a formalized version of a mental status.
I'm going to have you speak up a little louder.
Okay.
Sorry, it's hard to hear you.
Montreal cognitive assessment test.
And I'm sure the judge has heard this before, but for the record, can you tell us what tests or what examinations comprise this?
Of the mental status?
Yes. The cognitive test
Yes.
that you said was the first test you had to perform.
It's broken down into visual, spatial, and executive. Naming.
But the interesting thing about him testing his visual, spatial, and executive function is that he's already had a full neuropsychological assessment. So, okay.
Memory, attention, language, abstraction, delayed recall, and orientation.
Okay. And so how do you test for these?
First part, I have them. The very first question is something called trails, where he's connect.
And I don't know if he's supposed to give the details of those. I don't know if he's supposed to. And supposedly Wade did well on 5 of the 7 tests, and that's why this doctor felt that he was being forthright. And he also messed up the clock. Y'all know Letitia Stout also messed up the clock too. And so he didn't draw the clock correctly, and he didn't draw a cube. Okay. So so we know I likely have ADHD, but I can't draw a cube. If somebody asks me to draw a cube, I'm not gonna be able to draw a very great cube. I'm just not. But that doesn't necessarily mean that somebody has a traumatic brain injury.
symmetry when smiling, etc. And that was normal. Cranial nerve 8, check hearing. Cranial nerve 9, check palate. And does uvula go up when you say ah? Midline, that'll be intact. Cranial nerve 10. Can't really check 10 because that's more GI stuff and heart related. Cranial nerve 11, check shoulder shrug. And cranial nerve 12 is hypoglossal, which is tongue, and make sure his tongue goes out straight.
Well, as a result of these individual tests, did you come to any conclusions?
That he had horizontal, bilateral, nystagmus.
So this is the expert that the defense found. So he's a neurologist that said that he's going to get to the testimony in a little bit. He's going to say that there's something wrong with his brain. And I'll just go on ahead and skip ahead to that part. His testimony is not going to hold up well on cross-examination. It's just not. They're looking for a mic.
The difference. NeuroQuant is very helpful at showing us asymmetry because it measures this stuff, but we had no NeuroQuant. So I measured it myself. On the right side, which is your left, here, that's 3.55 millimeters. On the right side, that's 5.6 millimeters.
I would also like to point out this expert asked the radiologist to not examine the results. So, when you go for a scan, the radiologist normally writes up what they see or don't see. They normally give the doctor some information. He specifically asked the radiologist to not examine the MRI or to not write up anything about the MRI because the past CT scan said that it was complete. The radiologist said it was normal. And his reason for that he's going to say is the fact that the radiologist is looking for brain bleeds, or that they're looking for like something that needs immediate treatment, but they're not going to necessarily look for something that's chronic. And okay.
Meters. So that's quite a difference in the ventricle size for one side to the other. Next slide. And here you can visually see it with the left, or the right side is bigger than the left side. But also I'm going to point your attention to all this space here. In my opinion, his ventricles are very small for his age.
What is the purpose of the ventricle?
The ventricles are the space inside the brain where cerebrospinal fluid is. The size indicates if there's too much water in the brain or too much brain in the brain. His ventricles are too small, which tells me that he likely has a pretty good sized brain, which is why any amount of atrophy in it is significant.
I interrupted you. I'm sorry, Doctor. You're pointing out to the spacing.
So the space, you're looking at space all around his brain. Nothing. Space in between. And then up in front, you see the space. The space in front of his brain. So that indicates some frontal lobe atrophy. Not a lot of atrophy. He's got some frontal lobe atrophy.
So the neuropsychologist already met with him, and the forensic neurologist, or I think it was a forensic neurologist. I could be wrong. Y'all know me, and but there was, because I covered that testimony, Dr. Heisman and Dr. Mills. We covered that on my last video talking about this case, and both of those individuals said that Wade did not give good effort. And y'all are going to be happy when the next expert, the next expert, it's going to make sense. This is not making sense, and it's yeah.
Next slide. Back to the ventricle. This is another location just to show that I'm not just cherry picking.
Why did he say that? Just to say that I'm not just cherry picking? Why did he say that? He also said he's also going to say that he reviewed a boatload of, like, his style is very casual to me, but in court, I think there should be a level of oh, decorum, professional. I don't know. Like in court, you should come across credible. And I just had questions about some of this. And AC, so brain scans, a normal brain is going to unless there's an injury, all brains they just look different. And the things that he's saying he can see, the next expert is going to explain all of this a lot better, I think.
His right, which is on your left, is 8.03 millimeters. On the left, which is your right, is 9.48 millimeters. Note that this is all less than a centimeter.
Okay, I'm going to fast forward a little bit.
Emotional dysfunction.
How does that manifest itself in somebody's conduct?
It's going to cause worse behavior. It's going to cause less thinking. It's going to cause less likely to modify your own behavior, basically.
So he is saying, based on these smaller size, based on atrophy to the amygdala and to his hippocampus and issues with memory, that is going to make him more impulsive. But in my opinion, his crime was not a crime of passion. Like this was just like a substance induced, but like I think had been talking about wanting to do something like this anyway. This explanation does not make sense to me personally.
What was the other one? You said there were two.
Evidence of some brain injury. The atrophy of his superior anterior temporal lobes as well as his frontal lobes is an important combination.
Could that be caused by substances? But we're not going to go there.
When you have atrophy of your amygdala, which is one of your main points of your limbic system, it creates for emotional instability. It makes you more likely to get mad and not be able to calm yourself down. frontal lobe impairments cause one to be more likely to be impulsive and act without regard to consequence, act without plan, more likely to be irritated and agitated. And the frontal lobe is also important for stopping behavior arising out of your temporal lobe.
Also remember, I have this sped up. Imagine, so this is not the regular way this was. I have this at 1.25, okay?
Is it practical to assume that these injuries to the brain occurred contemporaneous with the traffic accidents?
The location of this, at least the atrophy, is typical
Of the what? I'm sorry.
of the atrophy, the shrinkage,
Okay.
where it pulls away from the skull, is typical of trauma to the brain. That's where the skull is the hardest, and that's where it beats up on the brain the most.
So if Mr. Wilson has been in custody since the date of his arrest, which was 2 days after the incident, presumably he had the same brain injury back in 2019.
Yes, but atrophy takes time to develop. It didn't just occur in the last year. It's probably been occurring over the last several years.
Is there anything that can be done to repair or replace?
No, but medication can be helpful at modifying his behavior, mostly from psychiatric disease, because this isn't somebody with this injury on top of bipolar disorder, major depression, schizoaffective disorder, whatever it may be. It's going to make it worse. So if you at least treat the psychiatric disease, and basically a simple answer is this can be treated.
Okay. So the problem that you have described as a result of the brain.
That's as much of this as I can take, okay? Because this is not gonna hold up well on cross. I'm trying to find the cross. Here we go. Okay, so I think this might be cross. Let's see.
But in this particular case, in that particular time, there was no accused.
So I'm gonna go back just a little bit, just trying to find the place. And I think this prosecutor is going to talk fast, so we'll listen to this normal and speed it up if we need
Case
to.
that he has some type of impairment.
Really? And what might that be?
To strangle a woman? Did he plan to do it? Or was it an impulsive action and an overreaction?
Well, we're going to get to.
So the expert shouldn't be asking questions. So that should be information that the expert should know. Okay, so the expert just asked the prosecutor, so how did this happen? The expert should already know. If you're saying that this was impulsive and all of this, but to me, the details of this crime was not impulsive. Like a in the moment, whoops, I couldn't control myself type situation.
To that in a minute. I want to talk to you a little bit about the head trauma. You indicated that you had an opportunity to talk to Mr. Wilson as it relates to the head trauma that he sustained growing up. Is that right? And you based your decision on, or your determination on, the couple accidents that he.
I took all those with a grain of salt and added to his physical exam findings.
Okay.
The abnormal reflexes he had suggested that he had some type of pathology, either in his neck or his brain. But people who have neck injuries frequently have brain injury, or vice versa. They have brain injury, they have neck injury too. So I don't know if his hyperreflexia was from his brain or his neck. But I'm here to evaluate from evidence of traumatic brain injury.
All right. Well, Mr. Wilson, when he's talking to you about his car accidents, he never gave you any dates, times, specific locations as to when these occurred. Isn't that fair?
Location was Tallahassee area, but in times, no.
You don't even know when that occurred, right?
I do not know.
You don't even know if that occurred. Is that fair?
As I have no medical records, as he didn't go to the doctor, I don't know.
Right. So you're relying solely upon what Mr. Wilson is telling you. Isn't that
I'm gonna speed it up.
correct?
I'm taking it with a grain of salt. If his neuro exam was completely normal, I would have a hard time believing it, but it wasn't normal, so I had to believe him.
Well,
Let's talk about that.
you also indicated that you had reviewed something involving his sister, Dr. Wendy, who happens to be a radiologist. Were you aware of that?
I knew she was a doctor, but I didn't know she was a radiologist.
Would it surprise you, sir, that when Mr. Wilson actually had an accident, that he went to the hospital, that he had CT scans that were done?
In 23, or when?
When he had his accident, sir.
I know, I didn't have a CAT scan.
So in 2023, so he was incarcerated in 2023, and it's going to come up later, but there was allegedly an OD with fentanyl that he was able to be like stabilized from. So that was the CT from 2023, and there was no evidence of head trauma or head injury at that time. He's talking about a car accident, and whenever that car accident happened, I guess the sister did review a CT scan, but he never had that one.
Well, would it surprise you to learn that his sister also had gone and reviewed those particular CAT scans and found them to be normal?
A CAT scan being normal simply means that there's no evidence of acute trauma. There's no evidence of blood. There's no evidence of subarachnoid hemorrhage, epidural hemorrhage, intraparenchymal hemorrhage, or anything that a surgeon has to deal with.
So when Mr. Wilson was telling,
It's also going to come out that this expert wasn't certified to give the test that he gave. So the test that he's basing his opinion on, there's a certification process. So you take the training. So he did take the training, but he didn't get the certification in it. And the state is going to point that out. I fast forwarded a
True,
little bit.
because his brain supports it, but I don't have any records to corroborate it.
well, did you have the opportunity to review a statement that was given to law enforcement by a gentleman by the name of Joshua Lukic?
That does not ring a bell.
Well, Joshua Lukic is an individual who called 911 regarding Mr. Wilson telling him that he had just killed 2 individuals. You didn't have the opportunity to review that statement, did you?
I did not have that statement, no.
Matter of fact, you didn't have the opportunity then to listen to that 911 call, did you?
I have not.
Did you review of the statement by Ms. Stephanie Johnson, who was with Mr. Wilson throughout the course of the evening and morning of the murder of Ms. Christine Melton?
I have not seen any statements.
So you don't know what, if any, effects or symptoms Mr. Wilson was undergoing back in October of 2019 when he committed these murders. Isn't that not true, sir?
All I'm testifying to is that his brain is such that he's more likely to be impulsive without recourse to consequences, easily agitated, and easily. This fits within the realm of possibility.
Well, it also fits in the realm of other possibilities, does it not?
A lot of other possibilities. Yeah.
I'll rule this one.
What are you talking about?
Well, you're assigning his actions to one particular.
Well, it's going to be multifactorial. Yeah, this is just one aspect.
Because like the impulsivity and the things he's describing also fit a few psychiatric disorders as well, and also voluntary substance use or abuse as well. And so
Aspect to his behavior. He's going to have drug use. He's going to have whatever is going through his head at the time. This is just one aspect that makes him more likely to do something awful than not.
Well, did it affect his ability to have a relationship with an individual back in October of 2019?
It doesn't stop him doing that, but it likely makes him more likely to be tumultuous.
How do you know?
I'm just saying, from his abnormalities, this is behavior that I would expect. I don't know it. I expect it.
Well, did you have an opportunity to corroborate any of that information? Did you have an opportunity to speak with a young lady by the name of Miss Melissa Montanez?
I don't know who that is, so no. But I had an opportunity to see him overreact and do things that he didn't want to do just when I was doing the mocha. I saw that behavior right there.
Well, it's in fact true, sir, that you didn't have an opportunity to see how he was acting back in October of 2019.
I met him last week. How am I supposed to know what he did in 2019?
Well, aren't you here to explain his actions back on the 7th of October of 2019, sir?
Based on his neurological abnormalities only.
you don't know what his ability was and what was going through his head when he went to a music venue that night, did you?
As ventricular asymmetry is typically congenital and atrophy takes time to develop, I would position that these findings are likely predating 2019, probably sometime after he was a teenager.
Well, if
Before
they're
his teenager.
predating 2019, you would expect some kind of symptoms to be present at that point in time, would you not?
And it almost seems as though he's saying, he did this, and so he must have done it because there's something wrong with his brain. But there are a lot of other reasons for behavior as well.
How long would it take for him to calm himself down, sir?
It depends on what's keeping it going.
Well, if he had atrophy, that indicates that he would have some kind of loss of brain mass, correct?
He has a reduction in brain mass. It's not gone, it's reduced.
Well, if you have loss of brain mass, wouldn't you also have ventricles that would increase in size?
Not when it's on the outside of the brain, such as the amygdala. His lateral horn is actually relatively large considering the rest of his ventricles. So
And I do think that this expert knows what he's talking about. It's just that they're trying to make this fit. And so this is going to be the state's expert. I'm going to see how he is at normal speed. He is he is a city medical examiner, but he has certifications in neurology, like in different pathologies. And he examines brains, he examines brain scans to talk about, to try to figure out why people do the things that they do. And so this was a very smart expert to call, I think, as a rebuttal to the previous expert.
Sure. Thomas Coyne, Coyne.
Dr. Coyne, did you testify in the guilt?
He is going to talk to her so much during this part. I'm telling you, if I was her, I would have asked to move. Like, hey buddies, can y'all switch places with me? He's gonna talk to her so much.
Phase of this trial regarding the autopsies that you conducted.
I did, yes.
What is your educational background?
Sure. I completed my undergraduate degree.
He is very certified. Okay, I'm gonna skip ahead.
Not send that patient on to get further imaging because, as physicians, we first do no harm, right? And anytime you order additional tests, it subjects that patient for possible harm or complications of that procedure.
Now, are you able to connect with what?
So yes, he is on lithium and I think like Celexa, or he's on lithium and one other medication. Okay. And they did a deposition of the previous expert. I watched that. It was more painful than that. If you can imagine the deposition. So he's wearing like a button-up shirt, but it's like unbuttoned. Like it's very Florida. It's unbuttoned to like here. Like it was a lot. It was a lot. His deposition was to me was worse than that. That was okay, I guess.
What you see on a scan and predict behavior simply from looking at a scan?
No, there's no poor correlation between looking at changes and imaging to predicted behavior. And
We're just not there yet with science because two brains could look this exact same and the people could have completely different symptoms. So one person might have one diagnosis and the other person could have a totally different diagnosis. We aren't able to diagnose behavior strictly from the brain unless it's a major abnormality, unless it's something like CTE. And CTE is going to come up in his testimony. I'm not sure, but we'll see how much of it we get through.
I think, Dr. Rubino talked a little bit about that with regards to Alzheimer's earlier, and I can speak to it from a
That one can be
pathologist.
diagnosed.
We certainly know that in patients with Alzheimer's disease, they can have brain degeneration with significant atrophy of the brain. And you can see that atrophy on imaging. And then if that patient dies, I can look at that person's brain and see an enormous number of plaques throughout the brain. but the level of atrophy or the degree of plaques or plaque burden doesn't necessarily correlate with predicted behavior. So I can't say that a person with this amount of atrophy would have, a corresponding amount of cognitive decline. Because there are a lot of individual differences. Each person has their own functional cognitive reserve. A lot of that's based on education, also based on genetics. So the long and the short is, it's very difficult to predict behavior from looking at a scan or even me looking at the brain itself.
So you would disagree then when Dr. Rubino testified that he could determine the defendant's behavior simply based on the brain scan?
Completely.
Now, another thing that was mentioned was the fact that the defendant had these football injuries and some sports injuries. Are you familiar with CTE?
Very much so, yeah. As a matter of fact, neuropathologists are the only ones that can truly diagnose CTE.
And can you explain what is CTE?
CTE, or chronic traumatic encephalopathy, is a type of neurodegenerative disease similar to Alzheimer's in the sense that the pathology is based upon the accumulation of tangles known as tau or hyperphosphorylated tau. The interesting thing about CTE, or chronic traumatic encephalopathy, is that what is necessary for the development of the disease is a history of either concussions or subconcussive injury.
And it's repeated. So if you think of football, if you think of boxing, but it's multiple concussions. And that's why most of those sports now have post-concussion um, protocols. Some NFL players or some people would try to fake that where they wouldn't do well on the pre-concussion screening. So if they did have a concussion, they could still, because you wouldn't notice a decline because they weren't putting forth 100% effort on the pre-test. It's really important that people not play through concussions, because a concussion is pretty much it's swelling in the brain, and the brain needs to heal. And that healing process, they really need to let the brain rest before going back and putting themselves in harm's way. It used to be looked at as like a positive thing for football players to, like come back from being knocked out and go back into a game, but we now know that that's incredibly harmful to their brains and bodies and to their long-term future.
To the brain.
Now, if you were to watch the news, it would appear that every football player
Yeah.
who hits their head has CTE. What
It's
is
not
the
just one
reality
concussion.
of that
That's
statement?
Repeated.
that's not true. As a matter of fact, my son plays football. I think the benefit of sport far outweighs those risks. And I say that because the prevalence in society for those with CTE is still quite low, even amongst football players who play recreational sports or at the collegiate level or even at the professional level. It's still around 3%, which is very similar to other neurodegenerative or the prevalence of other neurodegenerative diseases. There's a lot of selection bias with regards to CTE. That is because people who have symptoms are generally with those who then donate their brain to find out if those symptoms are due to CTE. And more often than not, they find CTE. But overall, no, the prevalence is quite low. We know that there is probably a inherited genetic predisposition to develop CTE, because in about 30% of those who have CTE, they have other comorbid neurodegenerative disease.
And would you expect to see evidence of CTE or some other abnormality such as that on the brain scans that were performed?
You could not necessarily see CTE, but you would see, with regards to chronic brain injury, what you're looking for, because the brain only has a single way really to respond to injury, right? Chronic injury, for that matter, looks very similar regardless of what caused those injuries. What we're really looking at is the pattern, the topographical distribution of those injuries. And that really allows you to say, is this consistent with or similar to a pattern we see in CTE or a person who's had repetitive concussive injury?
And looking at those patterns, is that the same analysis you would do for someone with traumatic brain injury?
Yes.
Now, are you also, you mentioned that you have training as a toxicologist.
Yes.
Now, are you familiar then with controlled substances and illegal substances and their effects on people's brains?
Yes.
Could you just briefly describe that?
Sure. I mean, most of your your stimulant substances, your psychoactive substances act primarily through brain receptors or specific brain receptors, mimicking the action of endogenous or normal neurotransmitters. And a lot of the desired effects are because of how it affects our brain.
Now, would you agree that drugs could affect your ability to think or to plan and to cause you to act impulsively?
Absolutely. Yeah.
And would you agree that people can just do evil acts without having brain injury
Correct.
or without having a mental diagnosis?
Yes.
I'm so glad that she brought that up. Some people can just do evil acts without having any brain injury because from listening to his phone calls, he doesn't show signs of like I mostly hear that he cares about himself. He desperately wants other people to take care of him. He does not accept responsibility for any of his behaviors. He frequently flips emotionally. He lies just excessively. I heard that interview that he did with the news station where he was denying any involvement at all. He tried to blame it on like this other gang. Like he's just like all these things he's done, it just seems to all benefit him. And it seems to be very convenient. And I'm so glad that she asked that question.
Now, as part of Dr. Rubino's testimony, he prepared a PowerPoint. I'm going to ask you in just a moment.
Okay, so he's gonna come down and point out just kind of, yeah, he's gonna point to some things.
Sure.
And are these the scans that you also reviewed prior to coming here today?
Yes. Yeah.
So let's start with this scan. What do you note about this first scan?
This is a horizontal section through the brain. You're looking here at the ventricles, which look more white, if you will.
So Karen, I want to point something out. All right. So he's actually more likely, so he is a bit of a punk. I don't know how else to say it. He doesn't do well when it's somebody comparable physical size. So he got his teeth knocked out. The teeth that he's missing, that happened in jail. So his dad said he does not do well with men. And, I listened to his dad's interview. I pinned it on in the comment of my last video. He so he picks women. He picks smaller men. Like those are the people. He is afraid of being in general population. And since he was attacked with the teeth being kicked out, teeth getting knocked out, he's been in protective custody. He hasn't been in general population. There are allegations that because some of the tattoos that he has are for a particular organization that he is not a part of. And that particular organization, it's my understanding, based on some videos I saw, it's my understanding that organization does not like people that are bisexual or homosexual, and so he would be harmed or like unalived if he was in general like there are allegations that there are people that would like him to be in general population. I'll just leave it there. And so it's all a mask. He because even Dr. G explains pointed out just how much anxiety you can kind of see behind his mask, that he plays off like he doesn't care. He's not an Adam Montgomery. So Adam Montgomery, Adam Montgomery, um, he showed no emotion. He showed no care. He he likely is harmful towards other people in prison. Like he is somebody that is aggressive towards anybody and everybody. This guy, he picks women. He picks on people that are smaller than him. He doesn't pick a fair fight. He just doesn't. And so, all right. I hope that's helpful. I'm gonna rewind just a little bit because I interrupted him. All right.
About this first scan.
This is a horizontal section through the brain. You're looking here at the ventricles, which look more white, if you will. And what he is claiming that there is asymmetry between these two structures. But by looking at the posterior horns here, you can see the length difference between the two. That's because this is not a complete level section through the brain. You're looking at a different level from the right compared to the left. So you're not comparing the same. So you can't make an accurate measurement here from one side to the other. You're going to get different measurements because of that.
And
So you have to look at the volume of the entirety of the ventricle.
And so based on that, do you believe there's anything significant?
No,
about this?
and I'll tell you further why, right? So if you had asymmetry in the ventricles, or let's say, for instance, he also described that there was an abnormality in the size of the ventricles, that they were actually more narrow or smaller. They're not. This is actually appropriate in size. And he suggested that because of that, there's probably due to increased intracranial pressure. But that doesn't happen in isolation. Increased intracranial pressure is going to cause fluid from the ventricles as well as fluid from the vascular space to spill out into the actual brain tissue. And that's going to cause abnormalities in the CSF pattern, as well as it's going to cause hyperintensities around vessels. You see none of that here in this actual scan whatsoever. Not to mention, increased intracranial pressure is going to push the brain parenchyma out. The brain is trapped in the skull. It has nowhere to go. So if you increase pressure inside that skull, the brain is going to be pushed outward and downward. And you see no evidence of that at all here. You don't see any evidence. You see the normal sulsation right here, or the normal folds of the brain. You have no evidence of that increased intracranial pressure. More importantly, like I said, there's no overt evidence of abnormality in ventricle size, and that matches what the radiologist saw on both the CAT scan and the MRI.
And what was the radiologist's opinion on the MRI?
It was
The
normal.
MRI was that there was no difference in the size of the ventricles. And that's important too. I know he had mentioned that normally a person wouldn't make comment of that on an acute CT. They very well would make comment of that, because if you see asymmetry on a CAT scan, what it suggests is that there's perhaps some underlying mass process that's pushing or changing the size of that ventricle that needs further evaluation. So a radiologist would certainly make note of that, and a doctor would certainly have to follow up with that.
Now, he also mentioned about the space, made some issue about the space between the skull and the brain. Can
You
you
talked about,
describe
yeah,
that?
sure. So this is a little bit higher up, so I can't really see the temporal lobes here, but you can certainly look at, so here's the frontal lobes of the brain, the orbital frontal lobe.
Trust me, this guy is very, very knowledgeable. Okay. And he pretty much is going to undercut everything that the other doctor just said. And so a lot of people say, why not just medicate an individual like this? And so there are people that are court ordered to take medication. Um, there are limitations to that. My most concerning diagnosis for Wade Wilson is the antisocial personality disorder. The fact that he seems to like doing crimes. He has a history of theft, of DV, just like being aggressive. He has this long history of not really caring about the law, not really caring about what anybody else thinks, only thinking of himself. And there is no medication for that. So there is no medication for dude just wants to break the law. Like there is no medication for that. Now, everybody has different opinions on the death penalty. That can cause an additional cost to the state. And but it's my understanding that on death row, he would be cut off from some of the privileges that he has now. He would likely sit there for a really, really long time. If the judge does do that, and based on all of this, I really suspect that the judge is not going to overturn what the jury decided, because the jury heard the testimony of the witnesses during this, and there's nothing new here, in my opinion, to overturn what the jury decided. All right. Um Christina, exactly. He has I don't have a care in the world. But he effed around and he found out. And I don't it was his attention seeking is a bit strange to me, because it was almost like he wanted his dad. I don't know if he wanted his dad to be proud of him. I don't know if he wanted his dad to save him. And I'm so thankful that his dad called the police and was in touch with the police and was relaying the information about like, "Hey, my son needs to be like the if what he told me is true, he needs to go somewhere." And I am very thankful that his dad did that. Um, all right. Let's go ahead.
Globes are the port.
All right. So we are just going to skip ahead just a little bit. So let's get to the cross-examination by the defense. It was not good at all. It wasn't very good.
Flocka to the mix. Let me ask you, what is Flocka?
Well, it's that very similar to the sort of novel psychoactive stimulants. It's sort of they have somewhat stimulatory as well as hallucinogenic effects in the brain.
And or cocaine, let's say. What effect would those have if you've got pre-existing minor, not necessarily traumatic, but
Well, it's very hard to predict because it really depends upon what structures of the brain are injured and where there's minor trauma. Because cocaine, is going to cause a massive alteration in brain dopamine, right? And so that's primarily going to affect,
And he does a great job pointing out that brain dopamine, on top of having possible bipolar disorder, schizophrenia, schizoaffective disorder, that can definitely interact. But it's my understanding that in Florida, you can't use voluntary substance use as a reason to not be guilty for a crime.
your respect to cocaine, limbic system, perhaps
excuse
some.
me, I apologize. What's limbic system?
Oh, sure. Those are the structures of our brain that include the hippocampus as well as the amygdala, the mesiotemporal cortex, structures of the brain that are interconnected there, and they really are involved in our emotions, our emotional learning, as well as short-term memory formation. Those structures are involved in taking our environment and sending on short-term memory to become long-term memory. But
To me, this expert did a much better job putting forth his opinions and why he thought the way he thought and just kind of justifying everything. This expert also explained that being tested in a jail could increase, because my understanding that he was shackled, there was a guard right there. That's going to activate the sympathetic nervous system, and that can make it more difficult to think. And so he did mention that as well. I am going to skip ahead to court, and we can see what's going on. I might need to refresh. Okay. So I believe, okay, there we
And
go.
then we'll come back.
Is that this judge? All right, so let's go back. Let's see what just happened.
Drive, there was presented evidence in the Spencer hearing this morning, and let the record reflect states present, defense counsel, and defendant present. You can be seated. Has that been submitted to the clerk?
It has not, I was considering it as a demonstrative aid to the court. If the court prefers that I file it, then I will. I've got it in my file.
I think it was made part of the record and referred to, so I think it's been identified. I would just, yes. All right, and when we left at the end of the Spencer hearing, the defense indicated they had further argument and potentially wanted to talk to Mr. Wilson about presenting anything further regarding the Spencer hearing.
We don't have any further evidence to present.
I did just want to note that his adoptive parents wrote a letter talking about how the impact of not having adequate mental health care and really feeling like the mental health system failed him. And this is where I do still think Wade has some responsibility. Now, it does sound like he didn't get an accurate diagnosis early on. But I still think he has to be responsible for his stuff too. I don't Yeah. I hold him maybe 70 to 80% because I do think he made some choices and he's responsible for his behavior. That's just how I feel. Those are my thoughts.
We're going to inquire of Mr. Wilson if you light, but he has elected not to provide any testimony in his defense.
So at this time, the defense does not have anything further in regards to Spencer hearing.
We do not, Your Honor.
All right, is that correct, Mr. Wilson?
Yes.
Okay. Anything else from the state?
So
Okay. Then-
he originally said that he wanted to say something, so I guess he must have changed his mind because before all of this, he said that he wanted to say something. And I wonder if he talked to his lawyers and I don't know. I don't know what happened there.
And you did indicate you had some argument in regards to sentencing.
I do,
All right.
but we need to approach.
Okay.
Okay, we're going to skip past this.
And as per the sidebar, I know Mr. Wilson didn't approach, but waiving his ability to be up here at the sidebar. And I'll just say what was said, that basically this morning we had the Spencer hearing. At the end of the Spencer hearing, defense counsel indicated they may have further argument and wanted to speak with Mr. Wilson regarding any other potential testimony. We recessed until 2:00 this afternoon. And so the court came back in to see if there was any further evidence or testimony, which appears there's not. And if there was any further argument regarding sentencing. Subsequent to that, I will take another recess and then we'll come back for the court to issue a sentencing order
How much time?
at that time. So that's procedurally where we are. Okay. All right. So is there any further argument then?
Yeah, do you want to get a podium?
Yes.
So the judge is going to take a recess and come back. So we'll get to hang out for a little bit while the judge takes a recess. Do we know how long yet?
Judge, briefly, you've heard all of the evidence, the testimony in the case. On behalf of myself, Mr. Hollander, Ms. Perez, Mr. Wilson, we want to thank you for your consideration of Mr. Wilson's sentence in this case. We understand that.
So this is where Dr. G explains. I'm going to go back to see where he does this, like he constantly sits with his nose kind of up. And Dr. G explains, talk about that being like a I'm better than you, I'm above you kind of stance. And I feel like a lot of this is a mask. I feel like a lot of it is just a huge mask. And so and he wants to portray this like I'm so big and bad and I don't care. I think there's a part of him that probably does care. And that's where internal family systems, because there can be these protective parts of us that can cause problems. And so there's a great book, No Bad Parts. It is a really great book. And that work has been done with individuals with that like this that have been convicted, that have done heinous crimes, because yeah, it's just it's so much. Definitely a false bravado. Definitely somebody mentioned, yes, Allison, like Chad Daybell. This like I'm superior. I'm nobody else can judge me. I think Chad Daybell's had this religious part of like feeling morally superior as well, despite having like done all the things he did.
Mr. Wilson's sentence in this case. We understand that when a jurist takes the bench, we hope you don't have to make a decision like this, but we know that Your Honor has paid close attention. You've considered the law, you've considered the facts, the evidence, and you're going to render the decision that you think is just. Obviously, it's either sentence is a terrible sentence. The sentence of death is worse in that if there is a mistake along the way and we can't correct that mistake, we can't correct the sentence after it's imposed. We'd ask that the court consider the
I'll also add that he also attempted to escape with another prisoner. He allegedly Like, so his cellmate wanted to put out an HIT on his, like, somebody was pressing charges against him, and so Wade went and told, hoping that he would get a lighter sentence, hoping that he could use that for his benefit. It was not to his benefit, and it's my understanding that's when he was attacked after that, after they found out that he had, and I'm glad that, like, I'm glad that he told, but he told for his benefit. That's why he did that. And so, I just think he's a very, very dangerous individual. I have some concerns. If I was on a jury, um, that would weigh very heavily. Um, Everybody has their own beliefs about whether the death penalty is okay or not. There was a case, I forget which state it was out of, but the individual to the end was claiming their innocence. This case seems different to me because he admitted it. And there are people that have this conspiracy, and I personally don't buy into that conspiracy, that, like, he was working for this organization, and they're the ones that actually did the crimes. But how he's bragged about what he's done and how he's talked about what he's done, I just I just don't feel it. I don't know. So, let's keep going.
3 statutory mitigators: the capacity of the defendant to appreciate the criminal nature of the conduct or to conform that conduct to the requirements of the law was substantially impaired. Obviously, you've heard testimony that he consumed quantity of controlled substances. He described it to the officers, said it basically made him almost insane. Defendant requires specialized treatment for mental disorder that is unrelated to substance abuse or addiction
You just
or for a physical disability, and the defendant is amenable to treatment. We don't know what kind of treatment that's going to be on.
I don't know why we're looking at his feet. I don't. Our I know Pablo was talking about thinking his slippers were too small. I have no clue why we're looking at his feet right now.
Death row. We know that he needs treatment. There's testimony to the fact that he's been on treatment. He's been on the same treatment throughout his stay in the Department of Corrections and in the Lee County Jail. He needs that medication. He
Yeah.
needs that treatment. Defendant cooperated with the state to resolve the current offense or any other offenses.
Oopsie.
I'm
Sorry.
sure the court recalls that Mr. Wilson
So the judge is going to take a recess. So we are about 6 minutes behind court.
provided a statement to law enforcement. At the time he provided the statement, he was not aware that they had located the second victim. He was doing that in an effort to assist the victim's family. They had already looked.
Okay. So what happened is he provided, because they were having difficulty finding one of the victims, and he, with his, I think with the help of his dad, they figured out where she was, and that really does help give the family some closure. It really, but, like, and I think he wants some benefit for that, I guess. I don't know. And the defense attorneys are just doing their job. They are just doing their job.
Located the second victim, but he didn't know that. He provided them with details that, but for his statement, they would never have known.
They might not have found her.
We have non-statutory mitigating circumstances. Defendant was born to drug-addicted teenage parents. The defendant's biological mother suffered mental illness. Defendant's mental illness presented at age 12 and was precipitated by puberty and substance abuse. Defendant was diagnosed bipolar disorder and I call it schizophrenia. It's a little bit different
Schizoaffective.
diagnosis. Defendant is loved by his adoptive parents, Candy and Steve Wilson, who has provided a statement to the court. Defendant is loved by his sister, which was reflected in the statement read to the jury.
So this is where I I see, but, like, just because there's a mask doesn't mean I don't know, because I feel like the emotion he's feeling is for himself and his life. I don't know that he's shown remorse for what he did to anybody, to any of his because some of his victims have survived, and I don't think he's shown any remorse for any of that from what I've seen.
Defendant was profoundly affected by being abandoned by his biological parents. He's been a loving son to his adoptive parents, as reflected in the statement read earlier today. I remind the court that the jury's recommendation was 9-3 for one victim and 10-2 for the other. Under their previous statute, that would have required this court sentence my client to life. Likewise, I would remind the court that Mr. Wilson has been waiting trial for a long time. The unfortunate death of his previous counsel prolonged the litigation and impacted Mr. Wilson greatly. Point out to the court, lastly, obviously the court has received, and I know that you haven't read them because I have received notification from your office that these letters have been received by your office, but I know that the court would not read an ex parte communication. That the letters have been sent back to us, but obviously there are people that have been pleading for Mr. Wilson's life and for the court's mercy. There are some 40,000 people that have signed petitions to that effect. We'd ask the court to take into consideration that death is permanent. Death is different. And we're asking the court to impose 2 life sentences for Mr. Wilson.
Steve?
Good afternoon, Your Honor.
Good afternoon.
I'd like to point out,
Okay, so they might give some details. The details of his crimes are horrific. The lack of disregard for human life. And it sounds like because a lot of this was instigated after an argument with I think it was his girlfriend at the time. And then between victim 1 and 2, he went to see her, and she could have been an additional because she was able to get away from him. And if she hadn't got away from him, like, you just never know, and so, I just wanted to prepare the chat. If you need to hop out because this part might get a little graphic, I'm not sure.
and I agree with defense counsel that death is in fact permanent. Christine Melton was 35 years old. Diane Ruiz was 43 years old. Both of their deaths were permanent. Back in June, when this court heard the facts and circumstances of this particular case surrounding the deaths of Ms. Melton and Ms. Ruiz, this court should have learned that this case was nothing more than power, control, and violence that led to murder.
Yep.
Mr. Wilson's decisions were not only pitiless and consciencelessness, but they amounted to tragically reducing Ms. Melton as well as Ms. Ruiz to nothing more than memories and photographs to not only their families, but also to their friends. The only reason why that happened was because they both encountered Mr. Wilson. The state, back in July, went ahead and prepared a sentencing memorandum for the court to consider. The reason why the state did that, Judge, was because the state wanted the court to be aware and point out specifically the facts and circumstances supporting the aggravating circumstances and factors that the jury considered in this particular case, and that the jury specifically found proven beyond and to the exclusion of every reasonable doubt. Specifically, the jury is the one that found that Mr. Wilson was previously or contemporaneously convicted of another capital felony or of a felony involving the use or threat of violence to the person.
Yep.
That particular fact an aggravating factor was established throughout the course of this trial by virtue of the verdict that was rendered by this jury when they found Mr. Wilson guilty of both counts of first-degree felony murder and first-degree premeditated murder. Secondly, Judge, the jury found beyond to the exclusion of every reasonable doubt that the capital felony was committed by a person previously convicted of a felony and under a sentence of imprisonment or placed on community control or on felony probation. Once again, this court, as well as this jury, received testimony, not only by virtue of receiving certified court roll prints, a certified copy of conviction as business records, but also received the testimony from our crime scene tag who conducted the fingerprint analysis and determined that Mr. Wilson was in fact one and the same of the individuals who was convicted of 2 felonies, that being trafficking in stolen property and false information to a pawnbroker on the 18th of September of 2019. That was less than a month before these murders occurred. That was established beyond and to the exclusion of every reasonable doubt, and the jury.
So it's my understanding because the individual that he did all of that to, because she came forward on, I think it was a podcast or something. It was another YouTube show, and she talked about exactly what happened. Very, very triggering. But that he like made her undress, he made her get in the back, he tied her up, drove her, like he like this just the things he's done is absolutely horrific. And for me, it goes beyond just somebody that has, schizoaffective disorder or any. To me, a lot of this is that dark triad. And we are definitely going to talk about that during the break. If 'Cause I think the court's going to take a recess.
Concurred unanimously on both of those. Capital felony was especially heinous, atrocious, and cruel. Judge, this particular factor screams for justice. The homicides by which Ms. Melton and Mr. Ruiz died at the hands of Mr. Wilson sets this case apart from normal capital felonies because, once again, it's conscienceless and it's pitiless. And it's unnecessarily torturous to both Ms. Ruiz as it was to Ms. Melton. You heard about the fingernails being broken, the many bruises to their body, of the face, the swollen eyes, the contusions, the bruising all over the torso and arms, the hemorrhages on both sides of the neck, the scalp bruising, the contusions to the lungs, contusions to the liver, to the back of the bladder, to the colon. Her brain was swollen. That was just Miss Melton. And then we have Miss Ruiz.
I think she was
She had the
unrecognizable.
fracture of the nasal bone, the laceration to her left breast, her bruising on both sides of her body, the bruising on the back of her left forearm and on the back of her left hand, the fracture of her fourth finger, the bruising on her right arm, the contusions on her upper back, the hyoid bone, the trachea cartilage being broken, the multiple rib fractures in the front and to the back. And then we have the hemorrhage on the back of her neck. And then you couple that with the fact that Mr. Wilson went ahead and placed his hands around the necks of both of these women and allowed their lives to slip through his fingers when both of them knew they were going to die.
And there are people that enjoy that. And that's my issue with him, is that he seemed to be looking for that, and that seemed to make him possibly feel powerful. I don't know how he felt in those moments, but that's the concerning part for me.
The jury found that particular factor, Judge, unanimously as to both Miss Melton and Miss Ruiz that it was heinous, atrocious, and cruel. He overpowered them, controlled them, he silenced them, by placing his hands around their neck. Judge, we submit to you that factor should be given extremely great weight. And lastly, Judge, the aggravating factor of it being cold, calculated, and premeditated. The jury found, beyond and to the exclusion of every reasonable doubt, unanimously, that this aggravating factor applied to Miss Diane Ruiz. That evidence that was presented, beyond and to the exclusion of every reasonable doubt, you heard and was corroborated by the evidence in this particular case, statement that was given by Mr. Wilson himself. He asked her where the high school was and if she could show him. He said that once he got her into the car, they'd drive to the school. He was going to drop her off, but he knew in his mind he wasn't going to do it. He started choking her because she started to get out of the car. You could tell that she was getting scared. He saw the fear, and then when she would not die, he pushed her out of the car and repeatedly drove over her and then attempted to dispose of her body in an empty wooden lot. Judge, that is what is precisely the sort of heightened premeditation that's contemplated by that specific factor. And we would submit to you that that particular factor also carries great weight. Mitigation that defense counsel has presented to this court, we would argue, counts for little weight. Not only that, but it's contested, Judge. It's controversial. Everything defense counsel has presented on behalf of Mr. Wilson, whether it be head injury, whether it be psychological issues, whether it be, family matters, all of that has been controverted. It has not been substantiated. There was no history of brain injury. It's not documented in any of the medical records. You heard here today Dr. Rubino's testimony. You heard counter testimony from Dr. Coyne. All of his scans were normal. Neuroimaging studies, both pre and post-arrest, indicate normal brain scans, although he'd have you believe that he had injuries to his brain. That is not anywhere in the record. As much as he'd like for you to believe it to be so, it is not.
Yep.
The review of the incarceration medical records do not indicate any type of cognitive problems whatsoever, Judge. You heard testimony by Dr. Eisenstein. That was controversial.
I'm just going to speed him up just a little bit.
By Dr. Herkoff. Dr. Eisenstein even went so far as to present evidence as related to the Dallas Kaplan, function system. He tested averagely, Judge.
Average.
He wants to talk about references to his memory, talking about that he has issues with short-term memory. That's not true. He has an ability to recount events when he wants to.
Short-term memory and long-term memory are two different things. He's kind of describing long-term, but it's okay.
He has an ability to tell stories. He has an ability to make you believe something that isn't true. And interestingly enough, Judge, the neuropsychological testing results are not consistent with any type of neurocognitive disorder. Even Dr. Eisenstein's own tests establish that the defendant's executive functioning, the frontal lobe capability to be within normal range. Judge, you haven't heard anything in this particular case as far as any sort of mitigation that would outweigh any of the aggravating factors in this particular case. The aggravating factors should be accorded such great weight, Judge, that they were proven beyond and to the exclusion of every reasonable doubt as to counts 1 and 4 in the indictment as specifically found by this jury. They, Judge, support and are sufficient to warrant a sentence of death. And they are not diminished by the mitigating circumstances and are sufficient to warrant the sentence of death. And as such, Judge, the state would respectfully request this court to recommend and impose the sentence of death upon Mr. Wilson, because not only is it deserved, but it's earned.
Anything else? All right. So this will conclude the Spencer hearing unless there's any other testimony or evidence that either side would want to present, especially the defense. Procedurally, my understanding is that we would take a recess at this point and then come back. And at that point that the state would want to present victim impact testimony or no?
Your Honor, I've spoken with the victim's family, and they would like to rely on what was stated at the
Previous.
trial.
Okay, so then this would be the final opportunity for the defense to present any other mitigating circumstances for the court to consider prior to coming back and issuing a sentencing order. Is there anything else that you want
We
to?
have nothing else, Your Honor. Thank you.
All right. And Mr. Wilson, again, your opportunity, if you wish to address the court, you may. No one can force you to. No one can force you not to. Is there anything you would like to address with the court? Okay. Then we will be in recess. It's 2:20 now. I'm going to spend some time on the sentencing order. So we will come back here at 4 o'clock.
Ooh.
And I'll present the sentencing order at that time.
All right.
Oh, another question before we go. I apologize. I know the state presented a written sentencing memorandum. Did the defense, I know you presented orally your
Right, no.
sentencing arguments. Was there anything else in writing that
No,
you wanted
sir.
to present?
Thank you.
All right. There was a PSI done. Did you all receive the pre-sentence investigation report?
Yes, sir.
Okay. And for sentencing purposes, I know that there were other charges that the jury found the defendant guilty of. If you would prepare any statutorily mandated fines, fees, or costs that are associated with those charges, do you have that? If you don't, that's okay.
I can't recite those, Judge. That's not a problem. I do
Okay.
have a score sheet as it relates to those additional charges as well.
Very well. Have you shown that to the defense?
Just so they know.
Any objection to that?
No, sir.
I'll accept that. All right, there's nothing else for the court to consider, then we will recess and I will prepare a sentencing order and come back here, said what, 4 o'clock.
Thank you.
We'll be in recess.
All right. Wow. So I want to get to some of the questions that I starred, and I appreciate you all showing one another because we can express differences, so we are not all going to agree. And the way that I've seen things in the comments, I've seen different people have different points of views, and that's fine. That's fine. But I haven't seen anybody like, you know, yeah, I haven't seen anything that would make me kind of step in. So we're good. Great question. So, is someone like him redeemable? What could therapy repair? Um, so his only options are the death penalty or life without the possibility of parole. Those are his only two options. If, let's say, he was considering, let's say, life with the possibility of parole was an option for him, he would likely have to do significant anger management. He'd have to do significant substance treatment, being medicated and remaining on medication, and then also working on those antisocial personality features, um, accepting responsibility for his actions, not manipulating, and getting needs met the right way, because his manipulation is so blatant, like, it's not sneaky. Like, he very clearly is like, "Oh, I love you so much. So, yeah, how's your week doing? Oh, I looked and I didn't get that gift you sent me. You might wanna check." And the person's like, "Oh, I'll send you another gift." Okay. Like, his tactics are very clear to me, and I think that's problematic. I don't know that he has a ton of reason to change his behavior. And what I mean by that is when we talk about stages of change, there's pre-contemplation, where I don't think I have a problem at all. There's contemplation, where yes, I have a problem. And then there are, like, you keep going up. Um, there is preparation, where I'm beginning to work towards change, and then there's action and maintenance. And that is a type of model that's often used in substance treatment because it also allows for relapse as well. And the only thing with him is him being in the community, does that place the community at risk? And my issue with him and his behavior is that he preyed on the vulnerable, the weak, the small people that could not stand up for themselves, could not stand up to him, and that could still happen. Um, that could just still happen. So that's my concern for somebody like that. Uh, are there treatments for but personality, there's a lot of debate of does personality change? And we know that dialectical behavior therapy is great for borderline personality disorder. We know that there are treatments for different personality disorders. The ones that seem to be more stable are antisocial and narcissistic. Those are two of the hardest ones to see change in because the a core feature of that disorder is that the person lacks insight and understanding or like a motivation to change their own behavior. There's that lack of empathy. So that's where it's hard. So I think in this moment, he likely blames his dad for calling the police on him. He likely blames Mila for making him mad that day. I don't know that he sees anything wrong with anything that he did. Or if he did, it would be like small, like, oh, those substances made me do that. Or like, I don't see him taking accountability. That's just where I am. Can you work towards that in therapy? Yes, you can. Okay. Could I touch on his behavior specifically toward women and how that plays into possibly his past experiences and who he is? So he seems to use his charm to manipulate people. And I think he views people that are attracted to him, people that like him, those are the ones that he's more likely to harm versus Adam Montgomery, who unalived his daughter, Harmony Montgomery. Adam Montgomery, he was explosive towards anybody and everybody. Like he just would take advantage of absolutely anybody. He was a lot more it was just different versus Wade. Wade to me, is a lot more, um my issue, like I said, is that he preys on the vulnerable. I wanna try to make this bigger because I wanna talk about the dark triad, and those are those characteristics of narcissism, Machiavellianism, and psychopathy, alright? And so, those dark traits. People with these traits tend to be callous, manipulative, will say or do practically anything to get their way. They have an inflated view of themselves and are often and are often shameless about self promotion. That's what I got from those jail calls. Just absolutely shameless to just ask everybody for anything. Because I think one person gave him $25 and was like, "Oh yeah, I should have another 25." And he's like, "Oh, you can't just put that 50 on there." Like he's just, ugh, ugh, okay. These individuals are likely to be impulsive and engage in unsafe behavior, in some cases, even committing crime without any regard for how their actions affect others. While many researchers consider psychopathy, um, narcissism and Machiavellianism as three distinct traits with overlapping features. Others believe that there might be some commonalities that suggest an underlying personality construct. All right. So, how is psychopathy related to the dark triad? Well, most researchers consider psychopathy a trait, that lack of empathy and remorse, to be the darkest of the dark triad. And so far as psychopaths generally cause more harm to individuals and to society than do narcissists or high mocks. People that psychopath is not a mental health disorder. In the DSM-5, it's antisocial personality disorder. What is Machiavelli's that one? It is not a mental health diagnosis. Rather, it is a personality trait describing a manipulative individual who deceives and tricks others to achieve goals. It is based on the political philosophy of the 16th century writer Machiavelli. Some evidence suggests that of the dark traits, Machiavellianism is most closely related to high intelligence. And his intelligence was average, but yes. All right. So, how to recognize the dark triad. All right, let's go through this. Manipulative, exploitive traits that are not representative in the big five factor model of core traits of an individual's personality, which are considered to be the most reliable and widely used model of personality to date. Blah, blah, blah. Dirty dozen. Okay. Do dark trait individuals easily conceal their true nature? Though there are physical behaviors and cues that have been shown to be associated with the dark triad in research findings, individuals with these traits may excel at hiding their true nature, especially at first. Narcissists, for instance, often appear charming and likable when you first meet them. And this can be due to that perception that they have a high self esteem and they might be kind of sociable. All right. So, all right. Then we also wanted to go back to the other one. Let me come back to the comments just to make sure I did not miss anything. Yes. So most cult leaders have that dark triad. uh, I'll leave that comment there. Yes. And I think he likes the attention of women, but I don't know if he actually has secure attachments in relationships. So relationships, once somebody doesn't feed his ego for half of that second or is upset with him or calls him on his stuff, I don't think he has a good idea of a healthy relationship. And so um the interesting part for me is that it sounds like he had a pretty normal childhood. Sometimes with individuals like this, you would expect them to have a completely like to show these behaviors and impulsive behaviors from the time they're like 2 or 3. For him, it doesn't seem to have hit until about puberty. And then after that, sounds like he started with substances and then kind of fell down a dark path, but he never took responsibility. And there are people that blame their problems on other people. And I shared something, and some people took it kind of personally because the goal of it was to talk about people accepting accountability for their behavior. I think that's incredibly important, and that I think people should move if they can, and it's a process. Move, even if I have been a victim of something at some point, to move towards that survivor mentality. And it often there's a lot of supports and things, but um yeah. Because when people start calling him on his crap, he breaks contact. So he likely doesn't have a lot of contact with his birth father right now because his birth father doesn't put up with his BS. His birth father went off on him. I listened to that call where he went off on him. When you talk about nature versus nurture, for him, there might have been a predisposition towards antisocial type behaviors, but I love the example that his dad came out of that and changed his behavior and has raised two successful, like he has two boys that are doing well, but Wade made different choices. And there are people that say, like, what if Wade could have stayed with his birth family? He still might have done some of these things because it sounds like his birth mother continued to struggle with substances and continued to just kind of struggle with things. And so his life still might have been a little unstable. Um, it's a lot. it really is a lot. And so, so I think all is it wrong for us to feel bad that he experienced adoption trauma, but still have disdain for him that he's done? So I think that's a more balanced view. So there is a small part of me that knows that he is, but after listening to all the, I don't know that he's redeemable though. And so that's kind of the hard part for me. I wish that he could see just what he's done. And that's where narcissism can sometimes protect people from their behavior. I think of Sarah Boone. Sarah Boone will never admit that like she did something wrong and that it was her fault and she should have done something different. Like she will never admit that. But it's that barrier that's like it's that external locus of control that nothing is my fault, nothing is in my control. I just met with a kid the other day and we talked about what's in my control and what's not in my control. And what's in my control are my thoughts, my feelings, how I feel. And then what's out of my control is everything else. Um, and uh, Denny Dawn, thank you for sharing your experience. There are people that are in similar situations, and they do talk about experiencing just that longing for knowledge about their birth family, or especially people that are in transracial adoption, that have that transracial adoption as well, because people can look at the family and tell that they were adopted, and so some people just have different experiences, and we have different isn't bad. Like people just have different experiences. And so let me see. Like his emotional expression is shallow. So that's something else that happens with individuals with psychopathic, with that antisocial personality disorder. So when he gets mad, he gets very mad, but it's like then you can like distract him with a cookie and he's like, "Oh, cookie." His emotions tend to run a little shallow and in my opinion. Um they go up and down. For any individual that is attracted to people that because maybe and there's some individuals are attracted to narcissists, are attracted to um, people that are antagonistic and might not be safe. And so, for any individual like that, in my work with them, we try to work on picking from your healed part and not that painful part. Because sometimes what can happen is for individuals that have been through a lot, sometimes they can interpret trauma as love. And um, mm, uh, the way that Wade loved, because he says he loves everybody. He says that he's engaged to Joey. Like he says all kinds of stuff, but it's all lies. All my opinion, my personal opinion. It's because he's only saying what he thinks other people want to hear. I don't know that he like can admit like his own thoughts and feelings because he only sees himself in the reflection of others. And he's desperate, like he wants other people to see him a certain way. He's more concerned with how people perceive him than who he actually is. And it's all an act. Like he's more concerned in being perceived a certain way than in actually changing his behavior, doing something different. And so that's where that self, that true self. Let me pull that up. That internal family systems. Um if I was working with somebody, and I don't work in jail settings, so like I likely would not be working with an individual like him. But let's say I was working with an individual like him, I would probably start with an internal family systems, having the person identify their values. Um, so this is just a graphic, and this is from Phil Delaney, phildelaney.com. So if you want to check out this, It is right there. I will, if you need it in the chat, please just put in the comments of the video and I'll make sure to put it there as well. I'll try to remember to put it in the description. I might forget. So, our true self, we all have this self that is calm, curious, creative, clear, connected, compassionate, confident, and that's the courageous part. We all have managers, that planning, controlling, criticizing, caretaking, pleasing, judging, avoiding part. We all have firefighters, the parts of us that want to soothe, numb, distract, dissociate, and for some people, it goes a little deeper. And then we all have exiles, those vulnerable parts. That's where those are the parts of ourselves that hold the trauma, the pain, the fear, and the shame. And the goal of internal family systems is to kind of manage these parts so that we can live from our true self, but listen to those exiles and listen to the different parts of ourselves. And so this kind of goes into it a little bit more. Um, all right. And so self is extremely important in the model of IFS, internal family systems. The goal uh, is to increase access and connection to self energy within the system. And that's where we want to come from a place of compassion, curiosity, care, calm, clarity, courage, confidence, and creativity. That when we live from that part, that we're gonna make better decisions and all those things. And so this just kind of goes into it a little bit more. Internal family systems is often very helpful for individuals that do have dissociation. And yes, okay, there we go. When psychopaths present as average and or charming, is it a conscious decision? So, um, individuals with those types of traits have learned to manipulate to get their wants and needs. Instead of just asking for what they want, they they manipulate to get it. So I already know. So I cannot stay on until 4 p.m. So when court comes back, so I probably have about 20, 30 more minutes left. But I definitely can't stay on until because I think I have a client. I'm almost positive I have somebody at 4. If I don't have somebody at 4, then I can stay on. But today's Tuesday. Yes, I have a 4 p.m. So I can't stay on. Some people might try to be like, "Oh, please," I don't know, like, "Will," I don't like, there's no amount of money, there's nothing anybody could do that can make me stay on until 4 p.m. I have a prior engagement. Individuals that have psychopathic type traits, antisocial personality disorder, they violate the boundaries of others to get their needs and wants met first. That's what's most important to them. And, and there are different variations with antisocial personality. There are some of the more aggressive ones. So that's where, I think I keep mentioning, Adam Montgomery. He used fear and intimidation and, like, aggressive aggression to get his needs met. Wade uses charm and he tries to be cunning and sweet and poor me, making himself the victim. That's how he tries to get his needs met. And so an individual can have similar traits and it present differently. And so we're talking about a spectrum. And at that spectrum, there are a lot of different people or there are a lot of different variations of that. And so I hope that's helpful. Let me know if y'all have any last minute questions, because if not, and we are waiting. So anybody, do we have a verdict on Tellus yet? Tellus. And I found that article. So I watched, if anybody's following the Robert Tellus trial out of Las Vegas. Um, okay. I think we're still, okay. Jury is still deliberating, it looks like. Okay. All right. So that's another one that I'm following too. Um, all right. Doo, doo, doo. Anytime, anytime. Uh, Denny Don, wishing you the best on your journey. Yeah. So court isn't okay. So for the Tejas case, we're still waiting. And then for the because the judge isn't coming back until 4 p.m. and that's Eastern. So right now it's 2:56 Eastern. So I definitely can't stay on until then. All right. So many cases because I'm also following Corey Richens. I'm going to wait until Corey's case actually goes to trial. They're doing the pre-trial stuff right now. That got a little spicy. I watched it with Emily D. Baker. I only have so much capacity for that, like until like I want to follow the actual trial. Oh, there we go, Lisa. I'm gonna come back to that. Let me see. Would you be able to look into an old case that involves postpartum psychosis? So I've done a video on that. I think let me check to see if I did. I'm almost positive I did a video on that. So with the uh let me check search my channel for postpartum psychosis. I've worked with clients that have had postpartum depression, postpartum anxiety. Yes, so I did a video on Andrea Yates, Lindsay Clancy. I will put that one in the chat. Feel free to check that one out if you haven't checked out that video yet. Okay. All right. So, Hybristophilia. Okay. So, with that, that is an individual that is attracted to serial killers or to people that do crimes. And as I mentioned before, there can be that passive and that aggressive type. There's really no like reasoning with people that are like that. So please don't try to like reason. People that are 100% Wade, they call them stands. I'm so old. Why they say stand? I don't know. People that are 100% Wade fans, do not argue with them. Just block them or like close the chat. Like just do not try to argue with them because it's just not going to happen. It's not going to work. All right. Um oh, I can find that one too. I'll find the article I was talking about. But there's some people that are just going to support him no matter what. They're going to believe all of his lies and that's just how they are and I'm not going to argue with that. Like just it is what it is. Those individuals are not going to seek help, but I do think that people that have healed or are healing from his harm that see how manipulative and everything that he is, those people might go to a therapist to say, I wonder what in me was attracted to that, was attracted to him. And that's something you have to work out with your therapist. Okay. Oh, Stan is a reference to an Eminem song. Oh, hyper fan is Stan. Thank you. Oh, good. Okay. All right. Thank you for that. Yes. So I'm super excited. So I'm going to partner with Melanie Little and we are going to cover that one together. So for the Carly Gregg case, I'm going to partner with Melanie Little and we are going to cover that one together. Now, let me find that TELUS article about his name. Because, and I found this, so this was from Hidden True Crime. It was changed that he changed the pronunciation for this trial because he has always called it TELUS, and then he all of a sudden changed it to Tejas, the more traditional the way that you would say it during his trial. This is it. All right. So let me share this screen. If anybody needs to head off, I hope you all have a great day. If not, we're just going to keep going with this. All right. So this is from the Las Vegas Journal Review. Okay. And so Robert Tejas was born with a family name that was synonymous with politics and public service, but the charge he has against Robert Tejas in Las Vegas has at least one relative thinking about changing their name. Tellis, 45, grew up in a once powerful political dynasty whose influence extended into all aspects of government in El Paso. It began with his great uncle, Raymond Tejas, and grandfather, Richard Tejas. The two men were brothers who returned to their growing border town of El Paso after fighting in World War II. Coming back from the war, a bunch of Hispanic veterans started to assert their desire for political participation in El Paso. So, this is Robert Moore, founder of the El Paso Matters news organization and longtime political observer. Raymond was the face and voice of that movement. Richard was the tactician. Raymond Tejas ultimately became the first Mexican American mayor of El Paso. He was tapped by President John F. Kennedy in 1961 to be the U.S. ambassador to Costa Rica. Today in El Paso, there are a street and a school named after him. Richard Tejas, meanwhile, so this is Richard Tejas, meanwhile, uh, was not content to being a mere power broker. He also served for nearly 20 years as a county commissioner and was a president of the El Paso Independent School District Board of Trustees. Okay. The pioneering work of the Tejas brothers did for Hispanics in politics is the stuff of legend. Richard Tejas used empty refrigerator boxes to simulate voting booths so that new voters would feel comfortable when navigating real ones. That's awesome. The brothers devised a scheme to mark the rosaries carried by Latino voters who couldn't read English. By holding the rosary up against the voting machine, voters would flip the lever next to the marked bead. Oh. Which one was the one to vote for the Democratic candidate? Whoa. By succeeding, but succeeding generations of the Tejas were not as successful as brothers Raymond and Richard. Richard's son, Raymond Tejas, who is Robert Tejas' dad, showed early promise. He was elected to 2 terms of El Paso City Council, but lost a bid for mayor in 1997 that many thought he should have won. One of the issues in that campaign was that Raymond Tejas didn't have a college degree. So Raymond finished his degree and then went to law school. It was a cool story. Then he got caught up in a major public corruption scandal, perhaps foreshadowing the political fate of his son, perhaps foreshadowing the political fate his son Robert would suffer. Raymond R. Tejas was charged along with dozens of other people in a conspiracy to bribe local officials for favorable votes. One bribery scheme involved a contract to refinance $40 million in county debt. Raymond Tejas pleaded guilty in the fraud case in 2008 and surrendered his law license. Though he got probation and didn't go to prison, his life in politics was over. Nerdy, reserved, and quirky. Years later, his son, Robert Tejas, would win election as public administrator in Clark County, Nevada. But he would lose his bid for re-election following stories about bullying and favoritism in his office. Those stories were written this year by Las Vegas Review-Journal reporter Jeff Gehrman. And authorities allege that they were a motive for the politician to fatally, yes, after police made blah, 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 blah. Okay, so that part. Robert had a chance to clean up what his dad did regarding his father's name, but I guess that the apple wasn't far from the tree. That's what a cousin said. Santonio Tejas. And a recent phone interview with the Review Journal from his home in Washington State, Santonio Tejas recalled the nerdy young cousin he used to spend Christmases with as a child in El Paso. He was never the jock. He didn't date pretty girls. He had self esteem issues. He was very nerdy, reserved, and quirky. Santonio Tejas and Robert Tejas and his two younger siblings, a brother and sister, followed their father's footsteps, attending a Catholic high school. Okay. A school yearbook from that time lists Robert Tejas Braggs as blah, blah, blah. Okay, whatever. A former high school classmate who spoke on the condition that he not be identified, expressed shock at the allegations. Blah, blah, blah. Okay, blah, blah, blah. Okay. I'm going to put the link to this down below. Robert Tejas' parents divorced in the 1980s, according to his cousin Santonio, leaving their three children to seek refuge with their aunt, Santonio Tejas' mother, who served as a pseudo parent when the children needed money or family with whom they could spend the holidays. My mother came home from work yesterday. She was crying about the news, understandably. All right. While in Colorado, Robert Tejas married his first wife, whom he'd met when they worked together at a Super Kmart in Denver. I remember Super Kmart. Burton said Robert told her he had wanted to become a thank goodness he can do that, border patrol agent in El Paso, but couldn't pass the vision test. Ooh. She said they had a daughter together and divorced in 2008 because Robert wanted to be center stage, while she preferred to be a stagehand in the shadows. Wow. I still wake up every morning thinking this is a crazy episode of Forensic Files that I manifested in my head. So out of character. So that's what they're going to say. All right. So I want to get to the part. There we go. People in El Paso still use the Spanish pronunciation Tejas for the family name, but during his time in Las Vegas, Robert pronounced it Tellus. All right. The Tejas name is recognized in El Paso political circles, mostly by old-timers these days. All right. So I'm going to put this article over in the description. Hope I shared all of this. Good. I did. I shared all this. Oh, so that just gives a little bit more insight to him. Just gives a little bit more possible insight. I think the jury is taking their time, and I have so much respect for juries because they really do have somebody's life in their hands. And if they decide on first degree, I believe they have to choose a sentence. So that could also be why things are taking a long time, or they're kind of talking about, is it first degree, second degree, like what is it? And then if it's first degree, I believe they have to pick the sentence. Yes. I've done a whole bunch of other videos talking about Robert, and some people talked about that so we talk about vulnerable narcissism. In my personal opinion, there are a few things that pop up for Robert, including that vulnerable narcissism and then OCD type traits. His whole crying over the state of his house after a search warrant. Now, I would be upset. So if somebody, ransacked my house, like if something like that happened, I would definitely be upset, but I wouldn't bring that up in front of a jury to explain why, like, I was in the bathroom for 2 hours. The prosecution did a phenomenal job talking about, like, hey, if this was a big conspiracy, why did they take him alive? Like, they could have, like, why did they do that? And the prosecution just did a phenomenal job with that. I so appreciate you all. I hope you all enjoy the rest of your day. I'll probably just share whatever the final verdict is. I'm guessing the judge is probably going to keep the death penalty verdict for Wade Wilson that the jury decided. I don't know that the defense produced any new evidence clearly that would justify changing what the jury found. I don't see any reason. My heart goes out to the family. because this likely reopened things for them, and I'm sure they're sitting back waiting for what's going to happen. And so I hope y'all enjoy the rest of your day. Bye.